Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and I'd like to spend a few moments talking with you about the future of medical marketing. At the present time, the marketing and practice promotion techniques that we have used today and in the past are not going to work in 2022 and beyond. The reality is that the internet has leveled the playing field, and now patients have as much information as their physician. In this video, I will cover 8 suggestions that are easily implemented into any medical practice that can be used to market and promote that practice. Number 1 is telemedicine. This really has been a game changer since March 2020. Telemedicine has been shown that it is a safe, effective method of managing patients without the necessity of being face-to-face with the patient or touching the patients. Prior to the pandemic, in March 2020, less than 3% of physicians engaged in telemedicine. Today, that number exceeds 40%. One of the benefits of telemedicine is that there is now parity in payment of a telemedicine or a virtual visit compared to an in-office visit. The truth of the matter is that practices that do not offer telemedicine in the future will probably be losing patients. Number 2 is video marketing. It is true that patients are more likely to watch a video than to read an article. Search engine optimization algorithms place a priority on video content, and you are much more likely to reach the holy grail, and that is the first page of Google. I recommend videos that are short. Less than 3 minutes are the most effective. Number 3 is psychographic marketing. We're all familiar with demographic marketing, which is the age, the gender, the race, the patient's address, their insurance information, and their occupation. But it doesn't really identify the mindset of our patients. Psychographic marketing identifies the habits, the hobbies, and health-related experiences of our patients. You can use psychographic marketing to create a specific message about your areas of interest and expertise, and allows you to promote your services to a given segment of the population. Number 4, we're moving from illness to wellness. The current healthcare system focuses on patients being sick and their symptoms and illness. 97% of the bloated $4 trillion healthcare budget is spent on marketing, on treating disease and disease care. Wellness is a proactive and focused approach for getting patients to stay well and not waiting till the patient becomes sick or symptomatic. Scientific wellness is a new field that uses a symptoms approach where we measure large data sets, including the genes of our patients, their biomarkers, and their microbiomes. As a result, we are able to move patients from illness back to wellness, and we can recognize patients who are likely to become ill in the near future and be proactive on managing those diseases. Number 5 is precision marketing, personalized medicine, which will be unique or for each patient. Unfortunately, at the present time, we are practicing treating patients as a one-size-fits-all. In the future, we're going to be able to offer patients the correct treatment at the right time and in the right dosage. Number 6 is the use of the virtual assistants, such as the ever popular Alexa, which will perform healthcare related tasks, such as monitoring glucose levels, see if patients are taking their medication as recommended by their physician. Alexa will assist with insurance claims. They'll furnish information regarding the hospital or the practice, giving parking information, and give advice to the nearest urgent care center. You will be able in the near future to take a photo of your wound or your injury and ask Alexa to give you an opinion on how to monitor that wound, or if it needs additional care and having to go to the office or an emergency room. Number 7 is managing our online reputation. The truth is we live and die by our reputations. 90% of patients will use online reputation or online reviews to evaluate their physician and or hospitals. And the truth is that just one single click can ruin a physician's reputation. We must learn to be effective in managing negative reviews. The best advice I can give you on managing negative reviews is to have many more positive than negative reviews. And that way a negative review is diluted. And finally, number 8 is artificial intelligence used in healthcare marketing. We're going to be spending a lot of money in the near future on artificial intelligence, and we can use those artificial intelligence to give our practices and our patients useful algorithms. At the present time, there is going to be speech recognition that will result in the doctor not having to enter data into the electronic medical record. One of the main concerns or issues that patients have with their doctor is the doctor is spending more time looking at the computer or the electronic medical record than the EMR. Using speech recognition to enter data into the EMR will result in no doctor entry and will replace the need for a scribe. I'm recommending that in the near future, a marketing budget is going to have to be in the 3 to 5% of your gross revenues. You are going to ask for marketing assistance, but ask for assistance from firms that have medical experience, and particularly if they have medical experience with practice similar to yours. Ask them what is going to be their anticipated results, and ask them how they are going to monitor success. Only this way will you be able to evaluate your marketing expenses and find out if this is working for you. My bottom line is that if you're planning to stay in practice for at least 3 to 5 years, you're probably going to have to consider implementing one or more of these 8 suggestions that were mentioned in this video. Most of these suggestions can be accomplished with minimal expense. Patients expect the same convenience that they are receiving when they log on to Amazon, when they apply for an airline ticket, when they reserve a hotel, or what they get from their stockbroker or their dentist, and yes, what they get from the urologist. Urologists are going to have to embrace some of these changes because patients are expecting these changes to be made available. And those practices that are embrace these changes are going to be the ones that succeed. The bottom line is that the toothpaste is out of the tube, that there are going to be greater expectations of our patients. And just as the toothpaste can't be put back in the tube, we can't resort to practicing the way we had in the earlier part of the 21st century. Well, I hope you have found this video helpful and useful. If you'd like a copy of my white paper on the future of medical marketing, contact me at the email address shown on this last slide. Thank you.